is universal in nature. It means it'll be blind to somebody's age, and it will mean in every instance that folks have the medicine that they require. And I think it's important to acknowledge that I think this is going to save an absolutely huge amount of money. I mean, forget about the fact that the illness it's going to save. The instances of other illness. I was with heart and stroke, and how tragic it was to see improperly managed diabetes manifest in cardiovascular events, or for it to manifest in so many other maladies. To prevent that loss of limb, is phenomenally powerful. And on the apparatus side, people shouldn't be forced to make a decision about whether or not they reuse a syringe, or whether or not they're going to be able to monitor their, manage their illness or pay for their groceries. So I want to thank you for your advocacy, and I think this is an extraordinarily important initiative.
Thank you, Minister. My next question is, long-term care homes were hit incredibly hard by the pandemic, and highlighted systemic challenges that must be addressed. And I know you're working on that, and it has been working to sign Aging at Dignity bilateral agreement with all provinces and territories. With 6 already announced, can you please share what work has been done on this so far?
Well, thank you so much, MP Sidhu. And there is, with these Aging with Dignity agreements, an opportunity to collaborate with provinces, to work with provinces within their own jurisdiction to look at the unique challenges and problems that exist there. In the first order, we want folks to be able to age at home and be able to get the access to the services and care that they need at home. And in the second order, we want them to be able to stay within their own community. One of the things that's exceptionally difficult to hear is folks who have to leave their home community and go somewhere completely foreign after a life of making contributions to their community because care isn't available locally. So by working with provinces, we're increasing services in the first order to help people age at home, and in the second order to make sure that we have the facilities like long-term care facilities to have people age in their communities. It's also in addition to the work that we're doing on health workforce to make sure that we have the doctors, the nurses, the nurse practitioners, the personal support care workers, and the oral health professionals, and now with our dental care to make sure that people have the full suite of care that they need for seniors who've made a lifetime of contributions.
Thank you. And my next question is, you said no women left behind when they're thinking about their sexual health. Sexual and reproductive health is health. Access to contraceptive and sexual health services is imperative. However, we know that too many Canadians cannot access the medication and services they need. Can you please speak to the pharmacist legislation that you tabled and why you started the universal access to contraceptive for Canadians?
Well, there's a lot of talk about freedom, but freedom over your own body, freedom over your own sexual health, freedom over somebody else telling you what you should or should not do with your body is perhaps one of the most fundamental freedoms that we could talk about. In making sure that every woman everywhere in this country has the access under their own recognizance to be able to get the reproductive medicines that they need to take charge of their futures and make decisions over their own bodies is not only an essential matter of medicine, it's an essential matter of social justice. And I think in this country, it is terrible that there is still so much stigma and shame around sex. The fact that we can't talk about our elbows and knees the same way we talk about our penises and vaginas is terrible. And what does that lead to? Well, when you don't have appropriate health information, just like when you don't have enough financial information, you're going to get taken advantage of. It means you're more likely to face sexual violence. Means that you're more likely to be sexually manipulated. Sexual shame is at the core of so many mental health maladies. How many young people have we lost because they're confused or worried if they're normal or okay? You are normal. You are okay. You should have autonomy and freedom over your own body. And we have to end the shame and the stigma that is imposed upon people to disastrous effects to their health.
Thank you, Minister. Thank you, Ms. Sidou. Suite, M. Thériault, pour 6 minutes, s'il vous plaît.
Merci.
Mr. Thériault, 6 minutes. Thank you, Chair. So, Dr. Lucas, I wish you great happiness in your retirement. Minister, on the 30th of November last, the committee recommended to the House the creation of a new register for implants, dental implants. A new log or register for implants? I'm sorry, I missed that. For breast implants. Chair, perhaps you could just give me a little extra time given this confusion. I was saying breast implants, a national registry for breast implants. Will this be created or not? We will take action on this very shortly. I highly appreciate the committee's work on this topic, and we will move on it shortly. I would like to know, though, take action on it. Well, it's not sending a letter to say it's too complex. It's, taking action is setting it up. Will you set up this registry? It's a unanimous report. It is our intention to ensure we will take action on this. There is an undertaking involving all our partners in this area. But of course, it is quite certain that we will take real action on this. So will you actually do it or not? Yes. Okay. Now, in February 2021, the Scientific Advisory Committee stated that it would be smart to create a fund to ensure that women could be compensated for damages. Will you go ahead on that? Your own advisory committee. I don't have a response for you right now, but I will continue to consider it, and I appreciate your bringing it up. All right. In February 2021, the Scientific Advisory Committee recommended basic research, a funding for basic research on breast implants in order to gather more data, scientific data. So where are you on this? Have you provided funds for research to, by the way, help with the registry for breast implants, or is there any funding for this? We are in partnership with the research sector in general, and it may be Ms. McLeod who can give you more specific details and who has specifically covered our undertakings in this area. Because in November 2023, Ms. Dreesen said that there still wasn't, any funding of research on this topic. So is that happening now or yet? Thank you for the question, Chair. I will analyze our research and our programming to determine whether grants have been provided for this purpose, and I will send that information to the committee. So you don't have the answer right now. Okay. Honourable Minister, a little earlier, and perhaps I'll have a chance to get back to this, you mentioned several times, actually, a fundamental principle being the right to self-determination of persons, the free choice in matters of bodily integrity. We have had a discussion in the past when you seem to be thinking about early directives, prior directives for people with neurodegenerative illnesses. Have you thought about that any further? Have you thought about ensuring that these people have the right to make these provide early directives? Yes, on the matter of early directives or prior directives, I've had conversations with the minister in Quebec and with many others across the country. As I've explained before, this is an issue. I mean, I myself understand that your perspective differs slightly, but to my mind, this is a very complex dynamic and issue. I do want to ensure that we continue to work closely with Quebec, collaboratively with Quebec, and with the other provincial and territorial leaders to work out a solution. A solution specifically with regard to the point you're bringing up, but also to ensure that whenever there's a situation where someone is in the types of situations we're concerned about, well, it is difficult because their opinion may differ from ours, because actually living in such a situation is different from, what we might legislate about it. I'm sorry to break you off here, but to intervene, but I'm not seeing any change. You seem to be repeating exactly what you said to me last time we talked about this. Have you or have you not read the Quebec legislation about early directives, prior directives, and what's bad about it? What's so complicated about it? I mean, it should be used as a model for the federal legislation. Yes, I certainly understand your point of view. But look, I think it's important not to work unilaterally based on a single province. We need to work together. That's not what I'm saying. No, but for me, that's the issue. Have you read the Quebec legislation? And what do you think of the Quebec legislation? Do you think it's overly complicated? Too complex? Do you think you could use it to base a federal bill on before the next election? I think that the conversation and the situation in general is a complex one. I fully appreciate Quebec's legislation, and of course I've had a chance to examine it. But for my part, I will continue my conversations with each province and each territory in order to work out a common solution. I fully understand that this is a highly delicate and emotional situation, particular for people who are living in these situations, who anticipate having a very difficult illness in the future. But at present, the conversation is ongoing. Thank you, Honourable Minister. Thank you, Mr. Thériault.
Please, for 6 minutes. You're muted, Mr. Davies. We can't hear you. If you could try unplugging and plugging in again. Otherwise, we have a request from Mr. Ellis to take over your time. We really hope it works.
Hello, can you hear me now?
Oh, we sure can, and we're very happy to. Go ahead, Mr. Davies.
We avoided a fate worse than death. Thank you, Mr. Chair, and thank you, Minister and officials, for being with us. I want to start by adding the New Democrats' appreciation to Dr. Lucas for your leadership. At a time when many people in Canada are saying everything's broken, you and your department helped build and create a solution by presiding over the biggest expansion of public health care in half a century by bringing dental care to 9 million Canadians and public drugs and devices to diabetics and people who need contraception. So I want to thank you on behalf of our party for the fine work that you and your department did on that. Minister, if I could start with you, can you confirm how many people have signed up for the Canadian Dental Care Plan to date? Approximately.
Yeah, approximately. It's a little over 1.5 million, all seniors.
Thank you. And on pharmacare, can you confirm approximately how much, say, your average person living with diabetes will save as a result of being able to access free diabetes medication and the devices that they may need?
Well, it depends a little bit upon the province or territory and what they're in and what existing coverage is. So it's a bit hard to answer, but I think it's fair to say that it's going to be very substantial. That, the folks that I'm talking to, and I'm sure members of the committee have had an opportunity to speak to, these costs can be extremely prohibitive and can be a major factor in them not being able to afford the essentials of life, and oftentimes are making decisions to forego medication or, as I mentioned, reusing syringes or not properly